Hey, Long Beach and community. Today is April the 27th. It's a Monday, and I want to just begin by giving everyone an overview of where we're at with COVID-19 and our response here locally in Long Beach, and then, of course, what we're doing across the state and regionally. We have Dr. Davis, of course, from the health department, who will be giving us an update from a health perspective and what's happening within the department. Then we have Alice Castellanos, who's going to be doing our Spanish translation and summary at the end, even after some of our questions. And so, si tienes preguntas en español o quieres escuchar esto en español, Alice will be doing it at the end. And then we have Paola, who is behind us, who is obviously doing translation in ASL and in sign language. So I want to begin today with a few things. First is I just want to really thank the Long Beach community. You all have done a really great job this last weekend of staying home and staying safe. I'm really, really proud of everybody. We know we still had some challenges and we're not going to get 100% compliance. But the truth is that a vast majority of individuals of our community stayed home. They stayed safe. They were away from our beaches. You did not come out in full force and overwhelm our enforcement efforts or our medical efforts. And so I just really want to thank the community. I think we saw what happened in other parts of the country, in certain parts of Orange County, and some of those images were hard to see because we know that level of physical closeness does spread COVID-19, and that will go back and infect other folks in the community. And so I just want to thank people in Long Beach for doing the right thing. And you maybe have heard earlier today, even the governor called out those communities and counties that he believes kind of jumped the gun as they relate to public health. And that's something that we're not going to do in Long Beach. We're all anxious to reopen, and I'm going to talk about that today. But we're not going to jump the gun and not do the right thing as it relates to public health. And so just want to thank you for the work. Want to go over some of our numbers. So the Long Beach Health Department, as of today, is reporting a total of 582 positive cases. That's, of course, a total number of cases that we've had this entire time. Of the 582, we have over 340 that have recovered. So 582, 340 have recovered from COVID-19. That's really the good news in those numbers, and so we're thankful for them. We also know that we have 117 positive cases at our long-term care facilities in Long Beach. And so we also know that all this data is available on our data dashboard at the Long Beach.gov site, open to the public 24 hours a day, so you can check out this information. We know that our death rate is at 31, and so that is something that we are monitoring. It's a number that we take very seriously, and a number that increases, and we're going to continue to see that number increase as well. The recent fatalities that we had, both were men where one was in his 60s, one in their 80s, had underlying health conditions. And like I mentioned before, a vast majority of our cases are still of individuals that are living in some of these long-term care facilities. Not all, but a majority are of our deaths, which is why we're paying so much attention to these long-term care facilities. But thank you for following our stay-at-home orders, and we're very appreciative of that. I want to start by going over testing and then how testing translates into our expanding what we're able to do and really reopening Long Beach and restarting this economy. So as we know, currently we have 4 drive-thru testing sites in the city, and then our Long Beach Health Department site, which is really a drive-up testing site that's by appointment only for some first responders. But of our 4 main drive-thru testing sites, we've completed over 3,500 tests at these locations. When you look at our private laboratories and the work they're doing, as of today, the city of Long Beach has done over 7,800 tests. And that is a number when you include our Long Beach exams that we're doing at our drive-thru locations and our private laboratories in conjunction. We've done about 7,800 tests total in the city of Long Beach. And I want to talk a little bit about what we're doing and how this expansion is actually working. We have some things that are important to note. We are first making a transition as well. We know that some individuals don't have cars and want to get tested and are having challenges with a drive-through testing location. So we want to say that beginning tomorrow, we will now be taking walk-up appointments as well at the Long Beach City College Pacific Coast Highway location, at Jordan High School, and at Cabrillo. We still would like you to sign up for a test online as you normally would at Long Beach.gov, the COVID-19 page, and sign up for one of the drive-through sites. But if you go to Long Beach City College, Jordan, or Cabrillo, we're asking you to come between 10 a.m. and 1 p.m. And if you walk up without a car, that is fine, and we will get you tested if you're symptomatic or meet the criteria. And so that's an expansion for folks. Obviously, some people want to take their bicycles or they're walking up. Those are all allowed. We got to make sure that we know we have a community that is diverse in the way people get around, including public transit. And so we wanted to make sure that was available to everybody. And we're increasing this capacity. We have some exciting announcements around that as well. So we're partnering with both LA County and the state on some additional testing opportunities. And I want to share today that we are opening up an additional testing site in the city of Long Beach. So we are in the days ahead opening up a East Long Beach location at the Liberal Arts campus, which is the campus right off, not too far in Long Beach City College on the eastern side. If you go down Carson in East Long Beach, you know it's with the campus I'm talking about. And so now both campuses, the East Long Beach campus and the Pacific Coast campus, will have testing centers. We'll be able to run up to 100 tests at the Long Beach City College location. And we're really excited about that location because we haven't had a location in East Long Beach. We want to thank, again, Long Beach City College, the new superintendent president there, Luann Bynum, and the board for their great collaboration. Really both campuses now becoming testing centers. And so we're very grateful for that. In addition to the Long Beach City College Liberal Arts campus site, we're going to open an additional location with the state of California. You may have heard earlier today, Governor Newsom announce an ambitious goal on really increasing capacity of testing across the state. One of the goals of that program is to go into communities that are rural, which is not the case in Long Beach because we're obviously a dense city, but they'll be going into parts of the state that don't have testing. And the other piece of that is increasing in areas where you're having populations that you're seeing larger numbers of infections, hospitalizations, and deaths. We know that in Long Beach and in most big cities, our African-American population is disproportionately affected. And so we are working with the state right now to open a second location for testing in North Long Beach. That site also will have over 100 additional tests a day. This new North Long Beach location and the exact location will be announced in conjunction with the state over the course of the next couple of days. But we expect by the end of the week, we will have both our Long Beach City College site open and the new partnership with the state in North Long Beach. Our largest African-American population is in the northern parts of our city, and so that's where the second site will be going as well. And again, I want to thank everyone for their patience and support. Now, what's interesting is as of today, we have the capacity. When you add the St. Mary Medical Center site, we have a pretty good capacity of tests. The exciting part for us is that once we open these two new sites, which we've already, by the way, have agreements on, and so these sites will be opening with the Long Beach City College site and the state site. We will be performing approximately 1,000 tests a day, or have the capacity to perform 1,000 to over 1,000 tests a day. Now, if you remember, and you've been following what's been going on, it was just not that long ago that the city was doing a few dozen tests a day. And then we were doing 100 tests a day. And this was early, if you look back a few weeks ago, when then this outbreak really was first beginning to really take hold in the city. And as a community, and as mayor and as a health department, we were very frustrated because we were expected to get an enormous amount of tests from our federal partners, and we were told we were going to get more tests and that they were on their way and to wait for these tests. Well, I think most cities know that commitment of tests never materialized, but instead, our city and our team, we set them out to go out and acquire these tests on their own, and we took initiative. And I just want to thank the Long Beach Health Department. I want to thank the folks at an emergency operations center, and they went out and got these tests. We bought these tests with our own resources from the city, our resources as a community, and then we combined that with our partners in the county and now the state to build what is going to be, by the end of this week, one of the most robust testing systems in the state of California, certainly for a city of our size. And so to be able to have this level of testing, I just want to thank the city team on. They've done a phenomenal job. Our hospital partners, St. Mary Medical Center. I want to thank Long Beach Unified School District, the board of Long Beach Unified, and the superintendent, Chris Steinhauser. I want to thank Long Beach City College, their board, and of course, the superintendent president, Luann Bynum. If it wasn't for the high school system, our school system, our community college system, and our own health department and health partners and St. Mary, we wouldn't be where we are. And so thanks to all of them, and of course to the governor and LA County and our county partners. This whole testing plan meets a critical key test of what Governor Newsom is calling for. You probably know that in order to reopen the economy, Governor Newsom, one of the key components of it is a robust testing system within our cities and counties. And I'm happy to say that we are now meeting that first critical component in that step in order to open up our recovery. And so now I want to just talk a little bit about that recovery. We are, as the governor has noted, and as I believe in Long Beach, we are weeks, not months away from some meaningful changes to our stay-at-home order and guidelines. These meaningful changes will allow us to get back to enjoying more of our outdoor spaces, getting more folks back to work, and opening up some additional locations for people to enjoy. Now, this will be done, of course, in a process that's safe and that's using all of the available data that we have while monitoring our hospitalization rate. Our hospitalization rate today, which currently is around 50, and I say that because that number is very fluid. But right now we have about 50 individuals in our local hospitals that are fighting COVID-19, and we wish them, of course, the best of our prayers and our support. That number is really unchanged, not much from the last couple of weeks. If you look at the numbers a week ago, that number was also around 50. I think we were at 48 or 49. Correct me if I'm wrong, Dr. Davis, about a week ago. And I want to say even 2 weeks ago that number was similar as far as our hospitalization rate as well, maybe not too far off. So over the course of the last couple of weeks, it's important for Long Beach to understand, well, we have not seen a huge uptick of hospitalizations. It's remained generally flat, it's a good sign. We also haven't seen a decrease of hospitalizations. And so it may be that we have really flattened that hospitalization part of the curve, but we need to get some additional information. And so that's something that we're monitoring and we're taking a look at. And so what's next? Well, we know that we have a economic recovery advisory group that's formed. They had their first meeting on Friday of last week, and they're coming up with ideas on the best practices on how we reopen. Part of that is going to be a survey system that we're launching tomorrow. So we're going to have an economic recovery survey that is going to go out to the community tomorrow. And this survey is an online forum for both residents and for businesses and small businesses to get input on the best practices on how we reopen up certain sectors of the economy. And so what that will look like is we will have that up, of course, on our website, and we'll be able to go to Long Beach.gov/biz. That's the number 4, B-I-Z. That survey will be up tomorrow on that site, on the economic development site. And residents and small business owners will be able to answer a few questions to get input, because we want to hear from the community on how best to reopen. In addition to that reopening, we're also looking at a couple different opportunities for folks to give input on a couple key industries. And so this economic recovery group is looking at the entire economy, but we're also, I want to highlight like what some of those kind of industry clusters kind of look like. And so, for example, we're discussing what are the best ways to reopen, for example, personal grooming in the future. How do folks go back to their barbershops or their nail salons in a way that's safe in the future? That is an industry area. How do we reopen, for example, and this is another one we're looking at, is small fitness studios. I think it's still going to be a ways away before large gyms are able to open up. But what if you are doing one-on-one training at a distance? Or what if you have a small class of 4 or 5 individuals and you can physically distance? Or a small yoga studio that puts in place some distancing. That's another kind of industry area cluster that we're looking at. Another example is going to be the outdoor recreation piece. We have beautiful parks and amenities in Long Beach. How can we begin to reopen some of those parks, or maybe reopen some of our bike paths in a way that's safe, and knowing that some activities won't be able to come back immediately. It's going to be very hard to have team sports in the next few weeks come back to the city of Long Beach, or to have folks actively playing together on playgrounds. But perhaps there's other activities in our parks or types of sports that are more individual in nature that can be done in open spaces that we can continue to ease back in. So whether it's some personal grooming activities, whether it's some outdoor recreation, small fitness studios, or even some kind of what we're calling low density retailers. So there's some type of retail that might be out there that can be done in a way that's minimized and that is very much inclusive of physical distancing. Those activities, those types of sectors will be called out, and we'll be looking for input in the survey that begins tomorrow. And we want small business owners, you have the best ideas. We've been talking to folks that I know that if folks own a barbershop, best place for ideas on how to do that safely are going to be from barbers and groomers themselves who have already thought through some amazing ideas. And so that's what we have to look forward to. Over the course of this next week, you are going to hear the city a lot and often gather information. So we're going to gather information from you through surveys, through our economic development recovery group task force. The city council is holding hearings, the economic development committee is this week to get input. So we're going to gather a lot of input and data this week because we are optimistic that we're going to be able to ease back into reopening the city in these weeks, not months, ahead in a way that's safe and that's important. And then the last thing I'll mention, I'm going to turn this over to Dr. Davis, is I just want to thank you again for the Coronavirus Relief Fund. Most of you are aware that we have raised over $1 million, and we raise every day into this fund. That fund has already distributed out over $800,000 to local nonprofits in Long Beach. This money is going to shelters, to people that are hungry, to people that are suffering from domestic violence. And I just want to thank you again for that, and to remind people that you can text the support LB to to 50155 and give anything you can, even if it's $5, to help with that fund. And so that's an update of where we are. This Wednesday and Friday, we will have more to talk about as it relates to this kind of restarting of where we're at with Long Beach and gathering your input in a way that's safe. And again, no one in this city, including myself, we should not feel pressured to move too quickly or to reopen in a way that's unsafe. It'll all be done safely. You have my word and my promise. And with that, I want to turn over to Dr. Davis with more of an update. Dr. Davis.
Thank you, Mayor. Good afternoon. I want to start with an update on symptoms that can be indicative of COVID-19. We continue to learn more about COVID-19 as a nation, and we use this new knowledge and data to help guide our response locally. The Centers for Disease Control and Prevention, or the CDC as they're commonly known, recently added 6 new symptoms to their list of common symptoms of COVID-19. Previously, the list was 3 symptoms, so it was fever, cough, and shortness of breath were the common symptoms of COVID-19. But recently they've added 6 more symptoms that if you get them, you could think that this could be indicative of COVID-19. So that includes chills, repeated shaking with chills, muscle pain, headache, sore throat, and loss of taste or smell. So if you experience any of these symptoms, you may want to think about getting tested. And you can visit our website, Long Beach.gov /COVID-19, or our info line. You can call our info line at 562-570-INFO 4636 to schedule an appointment for testing. There will be the COVID-19, the knowledge around COVID-19 is an ever-evolving landscape, so there is going to be more data and knowledge coming out, and we will be making changes to our guidances commensurate with that. Just wanted to mention, like the mayor said, walk-up testing is now available at 3 testing sites for those who don't have a car. And these walk-up testing sites include the Long Beach City College Pacific Coast Campus, Jordan High School, and Cabrillo High School. And then in addition to testing, I just wanted to mention that there's some great healthcare resources in our community, one of which is Tcc Family Health. Formerly known as the Children's Clinic, Tcc Family Health is a nonprofit health center system that has been serving people of all ages for the last 80 years in Long Beach. If you need a medical provider, if you're uninsured and looking for a medical home for your entire family, Tcc Family Health can help. They offer comprehensive medical, behavioral, and social support for your family's well-being. And they provide services to uninsured individuals and families regardless of ability to pay or immigration status. If you'd like more information, please call Tcc Family Health at 844-822-4646. Again, I just want to end by thanking our residents for the sacrifices you've been making in following the Safer at Home order, especially during this warm week. We've seen our numbers of cases plateau somewhat. As the mayor mentioned, we're not going up, we're not going down, and that's because of each of you. The city, we owe a debt of gratitude to you for what you're doing. We still have a long way to go, but we'll get through this together. Thank you.
Thank you, Dr. Davis. And we'll take a couple questions from the feed or from reporters.
All right, Mayor. The first question is coming from Rachel Jordan from Channel 7. Rachel, go ahead.
Hey, so this question is for the mayor. As temperatures, begin to rise over the next week or so, what is happening with the city's cooling centers and how will physical distancing be enforced?
So we are actually opening up cooling centers in Long Beach. That's something the health department's working on, and we will have physical distancing at the cooling centers. But that's really important to us. We understand that that's a huge need, particularly going into the summer, and especially for seniors. Particularly those that don't have air conditioning. And so that is being worked on. I imagine a plan will be in place in the next few days but we've been working on that pretty actively. So that's something that's been very important to us.
All right. The next question is from Philip Zonkel. Philip, go ahead.
Hi, this question is for the mayor and for Dr. Davis. The Long Beach Health Department in its demographic data on COVID-19 cases includes lots of information on various groups, but does not include the LGBTQ community. I'm wondering why that information is not being collected, and when will it start being collected?
So in general, there's a set of demographic information when you have a reportable disease that's collected. And that's on this report called a confidential morbidity report. And so traditionally, LGBTQ status is not collected on that report. These other address, name, race and ethnicity. So it's not really the standard throughout the country or the state to collect this type of information with a reportable disease.
Okay, not to make it.
And I'll just add, I mean, personally, obviously, I think it'd be great to have the information. So we're talking about this, and so obviously, I think that having, as far as what privacy rules allow us to, what we put out goes through a long list of kind of medical approvals as far as what we're able to put out. And so I think Dr. Davis, I asked her this question as well, and it hasn't been a reporting standard in the past, and not just here in Long Beach, but in most places. So we're trying to see if it's reported anywhere else in the state or country. And I know that you asked that question last week, and so we'll try to get the answer. And maybe Jake, once we figure out if it's being reported anywhere else, we can get back to Phil as well.
Yes, Phil, we're having some technical difficulties hearing your questions. We'll go ahead and follow up with you from the Joint Information Center with additional information relating to your.
And I heard it. Yeah, thank you.
All right, moving forward, I've got some questions here from social media on Facebook, and I would say a lot of these questions relate to testing. And one of the questions here was, the husband and I are both high risk and would like to be tested, but we're concerned about driving into an area where others are also waiting. The droplets hang in the air for a bit. How safe is it in the testing area for very high-risk people? Dr. Davis, if you could elaborate on that, that'd be great.
So when you drive in, you keep your window closed. They give you the testing kit, you do the test, and then you pass that back out. So it's pretty safe, and we really are minimizing the amount of time that you're interacting with the air. So I would say that it's a safe way to get tested.
And I'll add, having visited one of these centers before to see how it works, we're using huge parking lots, and so you're nowhere really near another person. I know sometimes you'll see a photo and all these cars are lined up, but that's almost, for most of the day, you're getting a steady stream of individuals, and because it's by appointment, and oftentimes the cars will park in a parking space and someone will come out to you and where the exam will happen. And so I find it to be it looks very safe to me. And there's a lot of distancing that happens. And so if someone, particularly if you're symptomatic, you should get tested. And as a reminder, we're transitioning testing now. And so not only are we doing symptomatic individuals, but if you are, we're testing all of our workers in our long-term care facilities, all of our patients, and now we're transitioning to testing other essential workers and that are in the community. And by the end of the week, especially this new site that we're going to be opening with this as a partnership with Governor Newsom and the state in North Long Beach, that site especially is going to have some really great announcements around who can get tested at that site, because we're not only going to expand the amount of tests we can do, which is 1,000, but we'll be able to expand also who we're testing. And I think that's something that we have to look forward to in the next few days.
Now that leads us to another question about the testing and the high-risk testing associated with that. There's a few individuals on Facebook that have been stating that they are high risk but have no symptoms. And Dr. Davis, can they currently get tested right now, even if they don't have symptoms but are high risk?
So if they feel like they've been exposed, they can still make an appointment and be able to get tested. So we would at least try to have, like, I think I've been around somebody who was coughing or who told me that they may have COVID or do have COVID.
And I think that's, that is, and the assessment, correct me if I'm wrong, Dr. Davis, is made by the medical professional. So if they, there's a screening process, and so if they believe that you may not have symptoms, but you were exposed in a certain way, or there's other, and you're at high risk, then I think that's a decision that's made on a case-by-case basis. But again, towards the end of the week, we'll have an even bigger expansion.
And Dr. Davis, this lends itself to another question about the waiting period for the results. We've had a few individuals here, specifically one individual stated that they were tested on April 15th at Long Beach City College, but have had no results. And those sentiments are being echoed by some of the individuals here on Facebook. What typically is the current wait period for the results coming back from a test?
So usually it's about 48 hours. I know that there have been some delays, and I know that we're working on that for some individual cases.
Yeah, and we talked about this last week. So almost all of our testing is done in 48 hours at all of our sites. However, at the Long Beach City College site, there was a period of time where if you got tested within a certain week of time, which I think that the person speaking was probably tested then, that specific location, those tests, which is a partnership with LA County, went to a certain lab where that lab was dramatically backed up. And so that lab could not get the test back in time. It was only at the Long Beach City College location. That problem has been fixed since it happened, which got fixed, I think, maybe a few days ago. But there were a group of individuals over the course of a few days or a week where their tests got delayed. In some cases, it was 3, 4, 5 days. And I've heard a couple individuals where they didn't get the results back. It was like something like 10, 11 days. So that did happen at that site. And again, that was an issue with the lab and that LA County partnership site at Long Beach City College, but that's been fixed.
Mayor Garcia, there's another question here about where can we fund food distribution for those that are in need? And I'm assuming that goes back to Long Beach Community Foundation. Can you elaborate a little bit more on that process?
Yeah, there's a lot of ways where people can get food that are in need. One, obviously, is we have great organizations like Food Finders, for example, like the Salvation Army that are right now feeding across the city. I'd encourage folks to look to organizations like them and others. Other ways are if you go to our section on our website on how people can get services or seniors, you call the health department line, I believe it's 570-INFO. You can ask for feeding programs and they'll connect. If you are especially a senior, there are multiple programs. We have our World Central Kitchen partnership, which is delivering meals to senior buildings and senior homes. And the governor also just recently announced a new program where we're going to be delivering out meals and are delivering out meals to seniors that need service, in addition to LA County, which also has a phone number and a program that is delivering meals out. All of this information should be available at the Long Beach.gov website, and that's where resources are. If someone is hungry, no one should go without food, and we'll get folks food. The food banks are out there, and that's why we're also raising money.
Great. Thank you. Mayor, we have one more question for you and then another question for Dr. Davis, and that will take the questions off of our Facebook live stream. The other question for the mayor is, it is my understanding that we will only make moves based on the data and our health department to reopen the city. And what's that plan look like?
I'm sorry, did you read the first part, Jake? You said
It says that one of the individuals states, it's my understanding that we will only make moves to open the city up based on the data and our health department. Is that correct? And what is the plan?
that is correct. We're going to reopen based on the data and the advice of the medical and health professionals. And so as far as the best ideas on how we reopen, we're all having that conversation, business owners, people within the health department, the community, our advisory groups. But the real question about when, which is different than how, they're two very different questions. The question about when is completely based off when the health professionals believe it is safe to reopen. And so that is the consideration that's being made on is safety first and public health first. And that will lead us to reopening in the best way. And here's the truth. Like I said before, we are getting to a point where we're going to start looking at some reopening and some opening up some spaces. We don't want to do that and then have an immediate health emergency where we spread the virus, where we can't manage it again, and then go back to closing. So the last thing we need to do is reopen and then go back and close again, because that will be even more devastating to businesses, to all of us, to people's mental health, and the whole thing. And so I think it's better to err on the side of being cautious, even though it's frustrating and a lot of folks are getting upset. I get it, but we got to be safe, and we don't want to do this again, especially now that we know that this could come back in the fall. We have to prepare and really figure out the best way of flattening out this emergency, especially if it lasts through the summer and into the fall. And so that's what we're doing right now.
Great, thank you, Mayor. That really lends itself to some of the questions about the economic survey opening up to give ideas back to the community forum. And so we're looking forward to that opportunity very soon.
And look for that survey tomorrow. We're going to blast that survey out through email. It'll be all over social media. We'll talk about it on Wednesday. We encourage business owners and community to get involved. And that is coming out of the work of the Economic Recovery Advisory Group we've put together. In addition, by the way, this is that survey, that group is also putting together work groups. So they're putting together small groups of barbers and groomers, and small groups of gym owners and small groups of business owners to also give input. So there will be the survey work, and then there's also going to be reaching out of small workshops so we get the best ideas. I want Long Beach to be the most innovative, safest city in the state to reopen. I think we have the talent to do it, and so that's what we're working towards right now.
Thank you, Mayor. The last question from Facebook is going to be to Dr. Davis, and this really gets into the status of the antibody testing. There's a lot of concern or just questions about testing. Can you elaborate on the types of tests that are out there, and then what it relates to? How does antibody testing relate to that?
So there's two different types of tests. There's one that's called the PCR. Another name for that is molecular, and then so that's one type, PCR and molecular. And then the other type is serology or a blood test. So in order to diagnose COVID-19 right now, the best way is with a PCR or molecular test. And what that's doing is actually finding or detecting the genetic material of the virus. So that's what we're doing in our drive-thrus throughout the city. So that's that one, PCR. It's very sensitive because it's finding the actual genetic material. Serology tests, what that's doing is it's a blood test, and it's detecting antibodies to the virus. So when you are infected with viruses or bacteria, as part of your immune response, your body makes proteins. It kind of sees this virus, and it mounts these proteins that are called antibodies to fight off the virus. And you have some proteins that happen really early, and then you have some proteins that stay around forever, so the next time you see that virus, you can fight it off again. So that's what the serology test is detecting. It's detecting those antibodies. The issue with the serology test, so basically what happened is when the serology test first came out, the FDA basically said, we are going to let these serology tests come out onto the market and be used without really weighing in whether they're effective or not. So the majority of the serology tests that are out there have not even been looked at by the FDA. There's 4 companies where it has been looked at, and they have this like special emergency use only authorization, which is how the PCRs are also being used. So to say all of that, to say that most of what's out there has never been looked at by the FDA, which means we don't know how accurate it is. We don't know how reliable the tests are. And so because of that, we don't really know how to use these tests. There's a lot of studies going on right now to try to answer that question. One of the studies was in LA County. There was another study from Stanford that was looking at how can we use these serology tests. And right now, the feeling is they're most useful if you're looking at a community or a population to see how widespread possible immunity is to COVID-19, because that's what the antibodies we think they tell you that you're immune. So we don't even know that yet. So right now, I would say the jury is out. I would say be very cautious in using these antibody tests, especially the ones that are rapid. So the ones that you can do and you get an answer in 15 minutes, those are very unreliable. Like, we just don't know It's, you know, I've heard somebody say it's like flipping a coin as far as what the tests tell you. So my overall, I think they are going to be useful. I think they're going to help us. We're not there yet. So just stay tuned.
And I think one of our concerns on the antibody tests is because there's so much uncertainty, particularly with the rapid response, that we don't want someone to go get an antibody test. You know, maybe it's not reliable, and then they think that they are immune to the virus, and then are out passing the virus around or getting sick themselves. And that is something that we've got to be very, very cautious of. The tests that are being done for the larger populations, obviously, because you have such a large amount of individuals involved in those tests, there's just more data available because there's more individuals. If you're doing a one-to-one test, it's much more unreliable. And so I just think that folks need to be very cautious about the antibody tests. It's not to say that they're not working in some cases, but until we have some real great federal guidance and some approvals from our the federal government on which tests we should be using, the city can't go out and endorse or say this is the test you should take because we're still, it's very early in the process. And so we're watching these carefully, and of course they're going to be part of our process in the future. Why don't we go ahead and do our Spanish translation, and I want to thank Alice Castellanos from the Health Department.
Muchas gracias, alcalde García y doctora Davis. Muy buenas tardes. Muchas gracias por estar con nosotros este día. Primeramente, queremos agradecerles a todos ustedes en la ciudad de Long Beach por permanecerse en su casa este pasado fin de semana. Sí vimos otras ciudades y condados y áreas que salieron como a lugares como las playas y eso en este momento para nosotros es muy riesgoso. Otra vez, muchas gracias por seguir las órdenes de salud que están a plazo en la ciudad. Desde hoy tenemos 582 residentes que han recibido pruebas positivas del coronavirus y 343 que se han recuperado. Los números de hoy incluyen 177 casos positivos en 16 centros de cuidado de enfermería de largo plazo. Desde el principio de esta pandemia, el Departamento de Salud está monitoreando 7 de esos centros de enfermería de largo plazo. 31 personas han fallecido y esto incluye 2 más personas desde el viernes y las 2 personas tenían condiciones crónicas y uno estaba en sus 60s y el otro en sus 80s. Nuestros corazones y oraciones están con esas familias durante este momento difícil. El coronavirus es el principal causa de muerte en la ciudad de Long Beach. Por eso es que es muy importante que todos sigan las órdenes de salud. Desde hoy tenemos un total de 3,005 pruebas hechas en nuestros sitios de autoservicio. Junto con las pruebas de laboratorios privados, han habido aproximadamente 7,829 pruebas hechas en la ciudad de Long Beach. Las pruebas están disponibles a personas con síntomas como tos, fiebre y falta de respiración. Para hacer una cita, el mismo día o por el día siguiente, por favor llame al 562-570-4636 o puede ir a la página de internet a www.long beach.gov/COVID-19. También algunos anuncios sobre otros sitios de pruebas en la ciudad de Long Beach. Tenemos unas noticias que desde ahora tenemos también sitios donde puede hacerse una prueba como walk-up site y esos son para nuestros residentes que no tienen automóvil en este momento. Se pueden realizar una prueba del coronavirus en 3 sitios. Estos sitios es en los mismos 3 que tenemos en el colegio de Long Beach, en la Jordan High School y Cabrillo High School. Cualquiera que quiera programar una cita también puede igualmente seguir los mismos pasos en la página de web de la ciudad de Long Beach para hacer una cita. Este aumento de capacidad de pruebas es fundamental para rastrear el control y la prevención del coronavirus. El Departamento de Salud también está trabajando con el otro sitio de Long Beach City College sobre la Carson para abrir un sitio con un estimado de 100 pruebas diarias y con ese sitio tenemos más detalles por llegar en los próximos días. Nadie será rechazado por falta de aseguranza o estado migratorio en las clínicas de la ciudad de Long Beach. El gobernador de California ha agregado y nos ha dicho también que la manera para empezar la reapertura de nuestro estado tenemos que estar enfocados en nuestra capacidad de poder sostener estas pruebas del coronavirus en nuestra comunidad. A medida que avanzamos hacia la reapertura de nuestra economía local, nos gustaría oír de usted. Queremos decirles que va a haber un foro en línea para brindar a los residentes y propietarios de negocios la oportunidad de brindar información e ideas sobre cómo la ciudad tiene que prioridad y unas estrategias también para reabrir las actividades de manera segura y saludable. Recordarles que primeramente vamos a priorizar la salud y bienestar de la comunidad antes de la reapertura del gobierno local y los negocios locales. También queremos avisarles que han visto muchas donaciones y actualizamos que más de $800,000 han sido repartidos en la ciudad de Long Beach a organizaciones que más lo necesitan. Queremos agradecerle a todas las donaciones que se han hecho por los residentes de la ciudad. También queremos agregar que el coronavirus, las agencias de salud y federales y estatales para ayudar a dirigir nuestra respuesta local sobre el coronavirus. El Centro de Control y Prevención de Enfermedades, o el CDC, agregó recientemente que hay 6 nuevos síntomas a la lista de síntomas del coronavirus. Ya sabemos que han sido, desde el principio, hemos visto que se han visto la fiebre, la tos y la falta de respiración. Son signos que alguien podría tener el coronavirus. La actualización reciente agrega que 6 condiciones más incluyen escalofríos, temblores repetidos con escalofríos, dolor muscular, dolor de cabeza, dolor de garganta y pérdida del gusto y olfato. Como también dijo el alcalde, tenemos otros sitios y pueden recibir las pruebas del coronavirus en varios sitios caminando y también con su automóvil. Además de las pruebas, también hay unos recursos de atención médica en nuestra comunidad, por ejemplo, como Tcc Salud Familiar. Antes se conocía como The Children's Clinic, y Tcc no necesita aseguranza. Están ahí para ayudarle con apoyo médico, salud mental integral para el bienestar de sus familias. Brindan servicios a las personas y familias sin seguro, independientemente de su capacidad de pago o su estatus migratorio. Si desea más información sobre esta clínica, por favor llame al 844-822-4646. Quiero terminar también agradeciendo a nuestros residentes por los sacrificios que han estado haciendo para seguir el orden más seguro del hogar, especialmente durante esta semana cálida. Hemos visto una meseta de números y eso se debe a cada uno de ustedes. Otra vez, muchas gracias por seguir las órdenes de salud. Eso es todo por hoy y que tengan buenas tardes.
Muchas gracias. And again, thank you all for watching our briefing. Our next one will be Wednesday at the same time, of course, 3 o'clock. And just stay safe, and we'll continue to beat COVID-19 in Long Beach. Thank you.